making you sick. I hate to admit it, but I would drink a Dr. Pepper every day. That has been gone. You know,
Yeah.
nobody's perfect, but yeah, that was my vice. I was terrible, and so I knew it was bad for me, but I didn't know it was bad for me. You know, when I saw it on paper, it really helped me be more strict.
Okay.
Okay, I promise her.
Okay.
Two questions. Is it chicken or egg? Do the testing first or do the detox?
Testing first.
Testing first.
Stop filling the bucket, make a bigger bucket.
And then my second question is cost of testing versus the cost of 21-day.
The 21-day program, what is that, Jamie?
It's $195.
The standard process, yeah. So a good program.
Right.
Yeah, less individualized, but yet a good program. Puts you
And then you-
basically on a paleo-type diet with
Oh,
shakes and
okay.
supplements to stimulate detoxification.
And then you could also meet with you beforehand to
Yes.
discuss some more.
What would be right for you? Yes. Yeah, I mean, I know it's expensive,
Yeah.
and the real world gets in the way of everything, sometimes what we want to do. So there are options available.
And are your visits covered by insurance or do you know?
For the nutrition stuff, oftentimes I don't charge for it. We sit down, do a consultation, chiropractic options for insurance.
So you're saying it's not really not enough to take the supplements unless you're following what you discovered with testing?
Take the quiz in the pamphlet, then you'll know.
Okay.
If you're high points on that quiz, then the testing is probably a good thing to do. Yeah, and there's all sorts of stories of people doing the detox without the testing first, and it can be successful.
The supplements that you offer, the first thing that traditional physicians do, particularly cardiologists, is say stop taking all supplements because it conflicts with your heart, your blood thinner.
Right.
So, and if you say what it is, they say they don't test against all these supplements. How do you know whether if you're on medication that's to prevent life-threatening diseases like heart disease and stroke, that you can do this stuff?
Some medications are easier to deal with the supplementation than others. Something like a blood thinner is more complicated. Something like a thyroid pill, you just have to adjust the timing so that if you are on medications that you're concerned about, we can talk about individually. In my schooling, when I had my toxicology class, the teacher said we know when we have A chemical and B chemical how they interact. As soon as we add in C, the possibilities are so endless, sometimes we don't know. And unfortunately, that's what happens.
But
when
there are a
there's
lot
much
of
going on.
supplements in your combo.
There's 4 in the combo, but they're actually very, like I said, every ingredient is listed,
Right.
and like the ascorbic acid is
It
right.
won't help, trust me. So,
Or
we'll get
with your cardiologist.
We're interested, so we'll get with you
Yeah.
privately.
Okay, great. So I'm going to conclude here. If you have other questions, please come up and ask me. I'm going to hang out. Yeah. It's better if I keep. That's part of my retest program. Think about what I do all day. Doing this all day long.
Right.
This. So yeah, I'm hard on it, but you know what? If I can keep it down as soon as I try to play volleyball or something that I want to do. It comes up again. All right. Thank you so much for coming tonight. I appreciate it.
So sorry.
Oh, and on the way out, we have little vitamin boxes, so you guys can grab one on the desk on the way out.